This is the peritoneum of the pelvis. In the main, the peritoneum is reflected from the anterior abdominal wall onto the upper surface of the urinary bladder. This is the urinary bladder. The peritoneum covers only the upper surface of the bladder and a small area on the upper part of its posterior surface, and is then reflected backwards to the front of the middle third of the rectum to form the rectovesical pouch. This is the rectovesical pouch, which is occupied by loops of ileum and the sigmoid colon. Note that the lower third of the rectum is not covered by peritoneum as compared with its upper two thirds, which are covered by peritoneum on the front and sides but not behind. On each side of the rectum, the peritoneum covers the wall of the pelvis, forming the pararectal fossa. Similarly, on each side of the bladder, the peritoneum covers the floor of the pelvis to form the paravesical fossa. This is the left half of a male pelvis to show the arrangement of the pelvic organs. This is the ureter. Its whole length is 10 inches. It runs half of its course in the abdomen proper, and the other half is in the pelvis. In the pelvis, the ureter descends at first vertically on the side of the pelvis, just anterior to the internal iliac artery. At the level of the ischial spine, the ureter changes its direction where it runs downwards and forwards on the floor of the pelvis. It then reaches the posterior-superior angle of the urinary bladder and penetrates its wall. The part of the ureter in the wall of the bladder is the intramural part, and this is the narrowest part. The ureter is related laterally to the external iliac vessels, obturator nerve and vessels, all of which run on the side of the pelvis, parallel to the pelvic bladder. At the posterior-superior angle of the bladder, the ureter lies between two structures, which are the ductus deferens above and the seminal vesicle below. The vas or ductus deferens. It begins as a continuation of the tail of the epididymis. It ascends in the scrotum and in the inguinal canal. It enters the inguinal canal through the superficial inguinal ring. This is the inguinal canal, and and this is the vast difference passing through it. It enters the pelvis through the deep inguinal vein, where it is immediately lateral to the inferior epigastric artery, very close to its origin from the external iliac artery. This is the inferior epigastric artery, and this is the vast difference just lateral to it. In the pelvis, the vast difference runs downwards and backwards on the side wall of the pelvis, where it crosses the external iliac vessels, obturator nerve and vessels, and reaches the posterior-superior angle of the urinary bladder, where it crosses above the end of the ureter, and then runs downwards and medially in contact with the medial side of the seminal vesicle. Here it is dilated to form the ampulla of the ductus deferens. It joins the duct of the seminal vesicle to form the ejaculatory duct, which pierces the prostate to open into the prostatic urethra. The structures on the base of the bladder are the two seminal vesicles with a ductus deferens medial to each seminal vesicle. This is the median part of the base of the urinary bladder. This is the prostate, surrounding the neck of the bladder. The prostate is surrounded by fibrous sheath, which is much thickened posteriorly to form a thick septum called rectovesical fascia. In this fibrous sheath lies the prostatic plexus of veins, which receives the deep dorsal vein of the penis anteriorly. The prostate is attached to the back of the symphysis pubis by the puboprostatic ligaments. These are two ligaments lying in the floor of the space behind the symphysis pubis, called retropubic space. This is the deep dorsal vein of the penis, seen entering the pelvis immediately below the symphysis pubis to join the prostatic plexus of veins.